So welcome everyone to the Community Health Policy and Planning Development Career Panel presentation. We have a great panel of some public health professionals and members of your CHPPD leadership team that are going to present a little bit today about their pathways in public health and where their career has taken them. And then we'll have lots of time for questions and discussion at the end. So be thinking about those once you've heard from folks. I am Tristan Sanders. I'm one of the co-chairs of the Coaching and Collaboration team. My fellow co-chair is Susan Caleb. I think she'll be joining us shortly. And we will get started with brief presentations, maybe about 5 to 7 minutes from each speaker, and then take questions at the end. So with that, I've sort of just assigned the order. I hope that's okay with our speakers, but our first speaker is Cynthia Williams. She's an associate professor and director of the Center for Aging Research at the University of North Florida. Her population of interest is aging and older adults and has both clinical experience as a physical therapist and prior business owner of a home care agency. Cynthia, if you could just give us your 5 to 7 minute introduction and we'll get going from there.
Thank you, Tristan. Like he said, I am currently the Associate Professor and Director for the Center of Aging Research at the University of North Florida. Just a little bit about my background. I actually came out of the clinical side of healthcare. So I was a physical therapist for 15 years. I still hold my physical therapy license. And later I went on to own my own home care agency. And through that and my doctoral work in health services research, I'm able to combine not only my present clinical background as a physical therapist and as a business owner. Through that time, I've used different types of health information technology for chronic disease management and on the business side. And so currently, I really have a really unique, I think, opportunity when I work with the community on different aspects of chronic disease management is I work with them on understanding who their patient population is and then designing an intervention. Most of the time it's around technology, but I think one thing that we keep in mind when you have that kind of patient, that kind of consumer background and experience of matching the intervention to the end user. And I think we hear that a lot from the community perspective, but understanding not who they are and what their needs are from a clinical perspective, but how does that affect them socially? If we design an intervention that's really great, but the community is not engaged with it, then it ceases to be as effective as we had hoped. And so it is that perspective that I engage and I work with the community on. And so what does the agency need? What does the patient population need to drive health and social care services? And so meeting the needs of both. When we can meet the needs of both, it's really at that point that we're on a path for sustained growth. I think a lot of times when we work with our communities, we look at kind of the quick fix or, what's the need and how can we kind of jump in with both feet and meet that need. But when we, particularly in today's kind of climate, one of the things that we really need to be mindful is what is going to be sustainable in terms of not only the intervention, but the continued engagement. And if that engagement has a definite end, how can we put a platform together so that there's continued progress where their community tends to thrive because it's been given the appropriate level of education, and then the nonprofit agency themselves are able to continue to support not only that particular individual, but the rest of the community as well. I think having both perspectives has allowed me to be a little more deliberate as I work with the community, and then allowed me to, because I do quite a bit of program evaluation, allowed me to support policies or help them to write policies that is evidence-based and it's really going to be more long-term in terms of outcomes. And so it's really been really a great experience for me to be able to combine not only my clinical background and the entrepreneurial background as I engage with the community, understanding the needs of both and how can we meet the needs of the both so that communities continue to thrive in their area of expertise. And so as the Director for Aging Research, most of my patient population are older adults, and we coalesce around the health and social needs, mental care, and some of the other ailments. And so as I partner with other professionals or other funders, it allows me to take different perspectives. And really, if I'm working, for example, working with a largely medical-based agency that perhaps doesn't communicate well in terms of technology or the business side, it really allows me to be a bridge between the different professions. So it's really been rewarding to work in the different settings and use my past experiences to further what's going on in terms of community health. Thank you, Tristan.
Great, thanks a lot, Cynthia. And we'll have plenty of time for questions and discussion at the end, so just keep track of what you might want to ask of whom, and we will get to that. But thanks for that. Our next speaker is Josefina Frankovich. So she is the coordinator of evaluation and communications and takes the lead on all evaluation communications with school district staff, community partners and families, and policy advocacy efforts for a community collaboration. Supports the health, safety, and well-being of children and families in West Chicago. She's in a small suburb outside of Chicago, and it sounds like her work has been evolving even quite recently. So we'll be interested to hear from her. Please take it away, Josefina.
Thanks, Tristan. So like Tristan said, my name is Josefina Frankovich. I'm actually a licensed clinical social worker and have a master's in public health as my background. And recently, I have now become the interim coordinator of partnerships, which I think really lends an interesting hand to this particular panel conversation. So just a little bit of background. I work for We Go Together for Kids. We're a community collaboration that's housed inside of an elementary school district. So we have a little over 40 community partners that come from across the county that we're based in, that come together to support families in the community of West Chicago through 6 different result areas. So our work kind of falls into many different buckets, including academic achievement for both students in the classroom and their parents for their continual learning, youth and family health, which looks at both physical health and social emotional well-being, community engagement, which really focuses on authentically co-creating a community and not having institutions kind of make decisions for a community and what they think is best. Stable families, which is really around basic needs being met so that families can reach their goals. Emergency preparedness, which is really around school safety, but also creating proactive communities that are aware of and prepared for any, whether it's man-made or natural disaster that may occur. And then early childhood as well. We look at all of the different particular areas that early childhood is really focusing on right now as an entire field. And so in my current role, I oversee that community collaboration. I am responsible for managing a $2.4 million budget, which is mostly through government grants, but we also have some philanthropy dollars that come in as well. And then I also oversee the community school work that We Go Together facilitates for the elementary school district here in West Chicago. And so I came into this position it's been a little over 3 years now, and I started off as the coordinator of evaluation and communications, like it says on the slide. And in that role, I took lead on all of the evaluation of all of the programming and activities that were happening within those 6 kind of bucket areas. That included data collection, data analysis, creating data dashboards and scorecards, and facilitating conversations with a variety of stakeholders to really ensure we're using data to inform decisions about how we should proceed moving forward. I was also lead for our communications, and so that was really about taking that evaluation process and putting it in a way that is digestible for many different populations. So being able to share with community members what we're doing and the impact that we're having on the community, being able to share it with teaching staff, with other community partners, And then the third piece I was also lead for was our policy and advocacy work, which is very new for us as kind of as an organization, but really taking a very intentional role around the state of Illinois and how funding is allocated to be able to really support families in the best. And so that position has kind of evolved, and we've had some changes in my current organization. And I think one of the key pieces there is that we go together for kids as a collaboration. Our community partners represent at least 50 different sectors: public education, the faith community, health, mental health, recreation, juvenile justice, library, you name it. And we probably have a partner who would say they represent that sector. And so for me in my role, what I'm really see myself as is a connector and a facilitator. We hold relationship building as priority in order to get work done. And so my background in both social work and public health really lends a hand to having a prevention lens to all of the work that we're doing, whether it's around public education or emergency preparedness or meeting basic needs. But my social work background also lends a hand to really using a strengths-based and an asset-based approach, where we're really leveraging all of the strengths that already exist in a community, that already exist in individuals, that already exist in organizations and entities, and we're really leveraging those as a way to kind of fill the gaps that we're identifying as we're doing work together. And so I think, Tristan, I was reflecting on some of the questions that you had shared with us as presenters, and I think one of the most interesting things for me is that I received my MPH and my MSW at the same time. It was a dual program that was rolled out at the University of Illinois at Chicago, and it was a fairly new program. There was very few of us in it, and there was a lot of still figuring out what it means to kind of blend these two fields together very intentionally, not having programs completed kind of separately and in silos. And so when I finished that program, it was very much, I wonder what kind of job I will be able to find now that I have these degrees. I kind of have a sense of where I want to go. I have a sense of where I have some just raw skill sets and how I want to try and grow those for myself in my professional career. And so for me, it was all about my professional network that I had that really led me to this position. It's kind of funky in that the position, because we're housed in an elementary school district, was posted on the school district's website. And I feel like I would speak for many people who are from the public health field or even the social work field, that you don't necessarily go to public school district websites to look for employment in the public health field. And so I was able to get connected to that position. And for the last 3 years, we've really been able to kind of tailor a lot of the work we're doing to be able to really use that public health focus. And so to kind of mirror what Cynthia had shared before, our main population that we're really focusing on are families in West Chicago. So families with children birth through 12th grade. We certainly support older adults or single adults who do not have children if they're engaged with families, but that is kind of not our focus when it comes to allocating our resources or kind of our people power. We're really focusing on families. And with that, I will stop.
Great, thanks so much, Josephina. Really interesting developments in your current work. Our last presenter is Khadijah Howell. She's a recent MPH graduate with a focus in health policy and management. She works for the Florida Department of Health on the State Health Improvement Plan, and in just the last month accepted a higher position within the department. So we are excited to hear what her latest developments are. Please take it away, Khadijah.
Hi, everyone, and thanks, Tristan, for the introduction. As stated before, my name is Khadijah Howell. I graduated with my MPH from Florida A&M with a focus in health policy and management in May, and the week before graduation, I accepted a position with Florida Department of Health working on their state health improvement plan, and in July, I accepted a position as a division policy and legislative coordinator with the Division of Disease Control and Health Protection. And So those two jobs are really intertwined in a sense, because with the job position I hold now, I not only do policy, internal policy, and legislative work, but I also still work with the State Health Improvement Plan. I do quality improvement and performance management work also. And once we start to get interns in, I will be the main person over that. So to give a little bit more insight about the current job I have now, on the policy side, I really deal with the formatting, editing, and content editing of our internal policies that trickle down from state and into our local CHDs or community health departments. And so for that sometimes comes in spurts. One day or some weeks I have 0 policies coming in, and in one day I can have 10. And the same thing goes with legislative side of things. Right now we're gearing up for the legislative sessions. And so down here in Florida, we have already started to get in bills and have to do bill analyses. And with my division, they call it the beginning of public health in Florida, because that division was the first division for public health in Florida. So we house environmental health immunizations, communicable and infectious disease, epi, pretty much your core public health focus. Those boroughs are under the Division of Disease Control. So we have a lot of legislative stuff happening right now. So it's been quite busy this week. They just started, but we started to get like legislative stuff back in July to get ready, especially with now that we have a new state surgeon general. So we've been meeting with him. And then of course, the governor and his priorities and his main focus being health, and with all the hurricanes happening. So we've been really, really busy down here in Florida. On top of that, like I said, I do performance management, and that deals from everything with making sure we are on track with our objectives for the state and agency strategic plans. With quality improvement, that includes small projects with the county health departments to the bureaus. They all have their quality improvement projects throughout the year. With the State Health Improvement Plan, I work with those priority area work groups that fall under the division, which is STD and other infectious diseases and immunizations. And of course, immunizations has been a huge deal on a national level. So of course, with Florida being the 3rd largest state, it's really impacting us. What else do I do? I am a person of many hats, you can say, but that is the short synopsis of what I do.
Excellent. Thanks so much. So I think you get to hear, 3 pretty diverse, different pathways in public health, and that is the formal sort of portion of this time we have together. We are recording this session, I should have mentioned, and we'll be sending it out to the full section for everyone. But at this time, we wanted to reserve as much time as possible, which it looks like we have about 35, 40 minutes, for some questions and discussions with our panelists. So I think the best way to handle this, and Brian, correct me if I'm wrong, is we can just unmute everybody. And if you have a question, hopefully we can manage talking one at a time. And if I hear none, I have listed a number of questions that I have for folks. So don't be shy, but I'll fill any blank space as we need to. So I'm going to unmute everybody. And if you have a question, feel free to jump right in.
Selfishly, this is Brian. I actually do have a question. I'm curious on what was, and any speaker can kind of answer this, what was the why on why you decided to go into public health?
Why don't we actually hear from all the speakers? We can go in the same order on that one. Cynthia, do you want to start?
Yeah, sure. So I actually just kind of really used kind of my natural passions there, and that was working with individuals really from a physical therapy perspective on the clinical side. And most of my experience with patient care was in a community. It was in a home. And so doing home health care for so many years, you really get a sense of really the comprehensive needs of not only patients, but their families as well. And so, you know, kind of bringing that with me into what I do now, even when I work with older adults, it's never about the individual or about maybe one person or even about a single need that they have. It's usually about the family, it's about the community, and the resources around them. And, you know, if we can support not only the individual, but the community around them, that's when community health and public health will continue to improve. I think we've all know of interventions or situations where we've helped one person and then they kind of go back and relapse, and we're continuing to throw resources at something but not seeing improvement. And so just kind of seeing what's out there, keeping your eyes open, and then understanding when you look at people, there's so much more to them than just that. And so my experience is really in home care and working with families and communities really has kind of driven me and really been a stepping stone to allow me to do what I do as a professor and as a director of the Aging Center.
Josephina, do you want to go next?
So, Brian, that's a great question. When I first started really thinking about my career, as many people do kind of in the later portion of your undergraduate degree, I was fully prepared to become a clinical psychologist. That had been the plan from the beginning. I had applied to the PhD programs and I was ready to move forward with that. And as I started to get more practical experience, some internships, and really being able to engage in it outside of a classroom, I really learned that doing individualized work was not where my passion was. That for me, I really could immediately feel that while individual work is meaningful and powerful and absolutely necessary, for me, it wasn't enough to help individuals, knowing that there will always be a system that is targeted to keeping certain marginalized groups oppressed. And so for me, what really drew me to public health, and certainly the social work for me portion it is intertwined. They're not separate for me. But what I really love about public health is while it is its own field, so much of it is innately intertwined with other fields as well. I mean, if you just look at APHA and all the different sections that are out there, there are so many other subfields that really use a public health perspective. And I think that was what really drew me into it as a place of study, a subject of study, is that I knew with public health under my belt, it would give me the foundational skills that I needed to be able to support whatever field I maybe would end up in. And that really worked out well for me now because my role does support 6 very different kind of quote sectors of work and a lot of organizations that do focus very particularly in one area, for example, mental health. But with public health as my background, I'm still able to make those connections and I think still really be able to enhance and kind of further the work that we're doing.
Great. Khadijah, do you want to answer the why?
Yeah, I think this is going to probably intertwine one of the questions that you had given us before the panel, but I had decided to go to receive my MPH. Originally I wanted to become a DO or a doctor of osteopathic medicine, and towards, I think it was my senior year in my undergraduate career, that I went to this panel, and this was during the whole Zika thing outbreak, and I had just came from studying abroad in those areas, and it was these doctors. A lot of them were MDs, and one was a DL, but they also had their MPHs, and I had never heard of an MPH or public health or anything like that because it wasn't in the forefront, because I'm originally from Tennessee. And they were also talking about the opioid crisis, and this was back maybe 2015, before opioid like really was out on a national front, and they talked about Zika, and they really had this really cool perspective, and I was like, okay, cool. So I'm gonna do like a dual program. I'm gonna be a doctor and I'm gonna get my MPH, but and so for some reason, somebody told me to like, not apply, and for med school. And so I just went on and applied for MPH. And in that time span, I really realized how much I have fallen in love with the field of public health, because my school made sure that we had a glimpse of every major sector of public health, and how that is like how all sectors are truly interdisciplinary. And that's just how I felt. So I kind of fell into it by chance. And yeah, and that's why I chose it, because I originally wanted to, my original plan was to go back to my city, which is Memphis, and really help out with healthcare there, because it's a huge healthcare market, especially when we talk about cancer research and trauma medicine. And so I think now I have a whole new perspective and understanding about why systems are set up that way, especially in Tennessee, which is a mostly rural state. And I think that kind of really molded why I fell in love with public health, because I found the reason why systems were set up in a certain way in my home state and then in my home city.
That's great. Other questions? Anyone? I'll pose a question. So this is for anyone that wants to answer, or everyone. Can you just talk a little bit about how mentorship or collaboration or networking was beneficial to you in your career path? Did any of you have specific mentors that you can think of, and how you might have used that, or specific networking opportunities that maybe led to something? Just curious how those sort of functions that we talk about a lot as public health professionals of being so important, how do they actually play out in your experience?
So this is Cynthia. I think back to my kind of educational path. My bachelor's, of course, was in physical therapy, and then my master's was in health administration. And then my PhD program, I really try to garner from my experiences and use those going forward. And so I always knew that I was going to get a PhD. I really wasn't quite sure how to frame it, having a physical therapy background and having a business background. And so I had a mentor in my doctoral work, and he really allowed me to kind of think outside the box. And so instead of, doing my research in PT, he suggested, well, why don't you combine, your business and technology, and look at, community health. And so, and not just having one mentor, but having several. I think what's been most beneficial to me is being around people who have very different experiences and who could advise me in very different areas, because I think what you begin to garner is the options. When you kind of go into your education, or you have your education or your career plan, I have like my 3-step plan, but talking to people who are going to kind of poke holes in your plan and cause you to rethink about, so yeah, you could do this, but why not consider this? Because you'd be able to do this. And so I think the more that you can surround yourself with people who think differently than you or people who have very different experiences, I think that'll kind of open up the opportunities to very unique career paths and perhaps things you haven't thought of that actually might be more fulfilling than perhaps maybe what, your original plan might be.
Awesome, that's a great answer.
I can share a little bit too. So I think I alluded to it a little bit earlier, but my networking and collaboration and just meeting people is what landed me this job in the first place. I wouldn't have known to have even applied for this job or that it existed had I not had an established network that I had kind of been cultivating while I was in school, knowing that I was going to be looking for kind of the start of my career immediately afterwards. But I think the other piece too is I have been incredibly privileged to have a true mentor as my direct supervisor. And unfortunately, she is just retired. And so there's a bit of grief that I'm still working through around losing her as my direct supervisor. But I think I have been in this role for about 3 years and have had the opportunity to experience a whole variety of opportunities that I don't think are generally typical for the role that I'm in or for how early I am in my career. And I attribute that to my mentor who knew the importance of being able to get a lot of those experiences under your belt early on in your career to really help you learn about yourself as a professional and the types of things that you want to be able to work towards as you're kind of growing in that infancy of working directly in public health. And so my mentor not only was able to provide me the structure that I needed to do my job, gave me the direct feedback that a supervisor should be doing regardless of how they build that relationship with you, but then she also always took it to the next level and challenged me to be thinking about why I was making decisions, what is the intent behind the things that I'm doing, the things that I am creating, and really challenged me to be much more holistic in my decision making, which has now allowed me to be in a place where I can kind of fill in the position that she has left vacant and have the skills to be able to do so because she spent the time to kind of build me holistically. And I have made it very clear to her that while she may be leaving the workplace, I refuse to allow her to leave my life, and I continue to plan on using her as a mentor for myself, both professionally and personally, to be able to really grow in someone who's looking to contribute to changing the world, which I think is why all of us are in the public health field.
That's awesome. Great. Khadijah, did you want to add anything here?
Yeah, I just want to reiterate how everyone's saying how vital having a mentor is. And sometimes we think the mentors are like these like super, super duper great and like powerful and sometimes we just romanticize mentorship. And sometimes it can, just like Josephina, it can be your boss, it can be your supervisor. I feel like I did not develop mentors until my graduate experience. And my main advisor, she's a mentor. And then while I was doing my internship, one of my preceptors, I do really consider her my mentor because if it was not for her, I would not have my job also. And so they're so vital because they not only support you and hype you up and get you motivated, but they also get you together, as my mom says. They hone you in and they really refine your skills a lot of times, especially if they know you need some improvement in certain areas. And my most recent mentor, she moved back to New Orleans to teach at Xavier, and I recently reached out to her about something, and she was like, "Of course." What took you so long to ask? And so those good mentors are always going to be in your corner, even if you do not maybe speak to them for a month because life happens. And they will help you in your networking. They will, like I said, get you together, refine your skills so that you can flourish in the way they know that you can.
That's great. And I think it's a really salient point about mentors come in all places, and maybe sometimes when you're not expecting it. Actually, one of my mentors was a peer, a colleague, somebody that I was just working with, who I was just in awe of the way that they actually did their work and actively tried to engage them as a mentor of mine. So be on the lookout. You might find a mentor where you're not expecting it. Did any other questions come up for folks on the phone? Hearing none, I will keep filling space here. I have a question again for sort of everyone if they want to answer it. It always amazes me in public health how people get into the positions they're in, and really the difference between whether you choose the position that you're in other words, you identified it, you pursued it, and now you're there, or if it chose you, and it was something that maybe you weren't sure about, but it was an opportunity that came along and you took it, and it potentially had an influence in shaping your career. So could the panelists just talk a little bit about sort of where you are now? Did you choose that path? Did you pursue that path, or did it kind of choose you?
Actually, this is Cynthia. I actually knew that I was going to, or I planned to get a PhD and teach, and research was always kind of in the plan there. Actually, when I was brought on at UNF, I actually was in the Department of Public Health. Because of my administrative background, I ended up teaching a lot of health org and health administration. So actually went our departments, but I ended up, because of what I was teaching, went there. So actually I'm in the Department of Health Administration, but still very much involved with public health, not only in my research, and my research center actually exists not even in my department. And so, for me, it just, I kind of saw where my skill sets were, and yes, I have to be teaching there because my business experience in health administration allowed me to teach there. It's provided me an opportunity to not only highlight public health to health administration students. I think that's important. It really refocuses them, or brings to light to, we're healthcare administrators and executives, but at the end of the day, we're there because people matter and the community matter. And so really kind of carving out that aspect in my teaching, and just really kind of making my way in terms of community engagement and carving that out for myself. And so I actually, when I took over the Center for Aging Research, we had a faculty that was retiring. The center was actually very different, and I wanted it to be more community-based, more interprofessional, and so I just made it happen. And so, sometimes if there's not a clear path or something that you want to do, you can kind of make it your own and get people on board and kind of build it that way.
Great, thanks. Josephina or Khadijah, did you want to talk a little bit about this?
Sure. So I think the original job that I was hired to do around evaluation communication was very much what I had set out to do. Program evaluation is kind of my niche. I enjoy evaluation and data and crunchy numbers and qualitative data. And when I was able to kind of evolve the position to include the policy and advocacy component, it kind of became my dream job, because those are both very big picture ways of looking at the work, and that's kind of where my comfort zone is. That's where I think I excel. But I think, the position that I'm in now still encompasses that, but now is much more an administrative kind of facilitator role. That's a bit broader, and less having the opportunity to really be in the weeds of evaluation and policy and advocacy work. But I have been enjoying it, and I think that I had the opportunities to build the skills that I needed to be able to kind of move up that ladder, essentially, to be able to be qualified to do what I am doing now. And so it's kind of a mix of both. Tristan, to your point around, I went after the particular job that I wanted, but the job I have now kind of came for me because of circumstances. But I'm finding that I'm truly enjoying it.
Great. Khadijah, anything to add?
I would say okay. I knew I wanted to be in the realm of like health policy, quality improvement, program eval. But I necessarily did not foresee myself being with a state agency, and that really just opened my eyes a little bit more and made me realize, like one of my mentors told me, to be open-minded on where you will land, because you land there for a reason. Most likely you land there to grow, even if that's not your end goal. Just take something from that and continue to grow in that. So I would say yes and no. The position I'm in is what I want to be in, but yes, because it's still in my field of interest.
That's great. And I think, you know, it makes sense that in some ways you pursue the things that you're doing, and in some ways it shifts along the way. That's just the nature of this work, it seems like. Did anyone else? I want to keep offering opportunities for others to ask questions. Anyone else want to chime in? Okay, well, I think, you know, we have about 15 minutes left. We might be cutting a little short of that, but I did just want to give an opportunity for all the panelists to address sort of the last question that I posed, or comment that I posed, which is really just, do you have any words of wisdom for those that are entering the public health workforce? I know we're going to be sending this out to the student section within CHPPD, and I had a number of students and interns in my office that were really interested in this discussion, and many of them just said, you know, any sage words of advice is welcome. So if we could just take a few minutes and hear sort of what your thoughts there might be. Cynthia, do you want to start again?
Sure. I think my big advice would be to keep your eyes open, look for opportunities, talk to different people, and I really encourage you. I mean, sometimes we look for people, for mentors in our field. I would encourage you to look for and talk to people who are not in your field, perhaps who are not even in community health or public health or not even healthcare. Many times I'll talk to people in technology, but not even health technology. They're in some other, you know, so a field so different than mine, but the innovations and the ideas that they spur, if I can find application to what I'm doing, it allows me to think outside the box, create a new box, and really to be more innovative. And when we think about the possibilities and the community that we work with, many times those possibilities, you know, we've borrowed from other industries. And so really look for opportunities that are outside perhaps of your area. Talk to different people. I actually have one friend that, you know, she has a plan of what she wants to do. And she, you know, every once in a while will just spend time. If she knows this person is in a position, she'll go look up their CV, or she'll look up their resume and look at how different people have gotten to a particular path. And it might be one path or one destination, but there's so many ways to get there. And so just because a plan doesn't work, doesn't mean there's not another path to get there. So I would say, you know, first of all, talk to several different people across organizations, across industries, and then look for opportunities to learn from other people. And it's okay to disagree, because sometimes that you learn more from the disagreements than you are from people who think like you. Thank you.
That's great. Some really good advice there. Josephina, did you want to chime in here?
Absolutely. So certainly I would echo everything that Cynthia has just shared, but I think a couple of other pieces. One of my mottos, I guess you could say, that I go to that I think has been really helpful for me is always leading with curiosity. So always kind of leading with questions, not making assumptions, and being really curious about why things are occurring the way they are. And so I think one of the biggest things when I remember kind of being fresh out of grad school and looking for positions, and when I started one, thinking, okay, there's a very prescribed way things need to be done, that they need to be accomplished. This is how things have always been done. And I would challenge anyone, whether you're starting off in your career or you're not, to really be really curious about what that looks like and why decisions have been made and why things are being done the way they are, and find ways to really engage in opportunities to entertain the idea of change and what that might look like. I think another piece that's been really helpful, and this is something my mentor shared with me when I first started, is keeping a professional journal. So really capturing for yourself what your journey is looking like, putting down accomplishments, putting down challenges, and having a place that you really capture those. I've not only found that to be very cathartic, but I've also found it very helpful when I've had to update a resume or submit some sort of application, that I kind of just have those there for me, rather than having to remember back to some of those small wins that really are probably much bigger wins than they might appear. And then the last piece, and I think anyone in any field would say this, but self-care, and just knowing that no matter what field you go into, you will likely never have a done to-do list, and that we live in a culture that sometimes it feels like those to-do lists need to be accomplished before you can relax and play. And I would challenge anyone to really shift that and think about how you learn to live with being okay with kind of a running to-do list, and how do you prioritize for yourself so that you really have that work-life balance. And I think that would be it. Thanks.
That's great. And I would really echo the professional journal comment. I've found myself so many times referring back to a journal that I keep in that sort of realm to update resumes, update CVs. I mean, you never really can grasp all it is that you do as a professional unless you write it down. So I think that's really great advice there. Thanks. Khadijah, did you just want to give any sage words of wisdom here?
I will reiterate what Cynthia and Josephina said as being open. I think we are at a unique time where public health is changing and being more interdisciplinary, and always look at how you can intertwine your passion with your job. I think that's very vital, and remember, it's the small things that make the big difference. And so it goes back to what Josephina was saying as far as keeping that balance and knowing when to work and play, because that's the only way you grow. And so that's my word of advice. Oh, and those who are younger stepping into the public health field, do not be afraid to take chances and go for jobs and opportunities that you may feel because of imposter syndrome that you should not go for, but go for them, because like as I said before, public health is changing, and now is the time to really take those chances and make a difference.
Awesome. Thanks so much. Some really great thoughts there, and some really good advice for those looking at the public health workforce. So first, I just want to say thank you so much to Cynthia, Josephina, and Khadijah for participating on this panel and sharing your unique paths in public health. I think it's great to hear from people that have that lived experience and are always willing to share. So a big thank you to all of you. I also just want to say, this is the first sort of public outward-facing coaching and collaboration event that we've held. And I just want to say that we are exploring options for more opportunities to connect for folks in the CHPPD section. So be on the lookout for additional announcements about other ways to connect virtually, ways that we can connect at the annual conference, and just know that there are thoughts going around about how we can sort of foster more collaboration amongst folks in the section. So be on the lookout for that. Brian, did you want to add anything here to close us out?
No, just thank you, Tristan, Susan, for all of your work that you've done with our section, and definitely to all the people that are listening to this or on the call. We're here, we are your CHPPD community, and so we're always looking for ways that we can connect people and bring us together as a community always. So I think that's all.
Great, thanks. And with that, this recording will be available. We'll be sending it out through the various channels that we can. So I hope any of you that listen enjoy it, and feel free to connect with any of us if you have any questions or thoughts about coaching and collaboration, or even just want to connect further. So thanks a lot, everyone.
Thank you.
Thank you.
Thank you.